The topic of this editorial is whether it is better for senior Americans to enroll in the traditional Medicare or the Medicare Advantage. I'm Dr. Hagop Kantarjian from the MD Anderson Cancer Center, and I'd like to discuss the editorial that we recently published in the Mayo Clinic Proceedings. It's entitled Traditional Medicare or Medicare Advantage, the Leukemia and Cancer Perspective. And I wrote it with several hematologic malignancy experts, including Drs. Amer Zaidan from Yale, Amir Fathi from MGH, Ethan Stein from Memorial Sloan Kettering Cancer Center, and Drs. Vincent Rajkumar and Ayolu Teferi from the Mayo Clinic. And to give you a little bit of a background, the Medicare enrollment period is now ongoing, and it ends December 7. Senior Americans are now exposed to numerous advertisements, phone calls, other mechanisms to enroll them in Medicare Advantage rather than the traditional Medicare plans. And these campaigns have been quite successful because the enrollment in Medicare Advantage has increased from 13% around 2004 to over 50% today. So as a background, traditional Medicare is the government healthcare plan, and its main mission is to help older Americans secure the best healthcare possible within the confines of the program. On the other hand, Medicare Advantage is mostly a for-profit insurance alternative, which proposes to do more for less, and hence the name of the Medicare Advantage. So it tells senior Americans that in addition to traditional Medicare, they can have coverage for hearing, dental procedures, vision, and others. So it's attractive to Americans because they pay less and they have, according to the advertisements, multiple additional options. So it's important to compare these two programs because when senior Americans are healthy, the Medicare Advantage offers more advantages and the senior Americans pay less. But when they get sick, the picture is very different. So this is when they will start seeing that the networks where they can access healthcare for serious problems are very limited. There are limits to the best experts that they can see. And for every procedure or treatment, they have to have a pre-approval, which results in many delays and denials. So the reason we wrote the editorial is, as a leukemia doctor, for example, if I get 10 patients who are referred to me as an emergency, I bring them all to MD Anderson or to a leukemia expert facility. We reduce the early mortality, we do the best diagnosis, we provide the best treatment, and within 4 weeks, the patients are in remission and ready for the curative consolidation and maintenance. And this is when half of the senior Americans are required to change their care provider, go into narrower networks, which in many instances do not exist in rural areas or suburban areas, and this causes delays and harm to the patients. So to summarize, the Medicare Advantage is a good option for healthy senior Americans. It doesn't matter because they are healthy, so they pay less and they have additional benefits. But we have to always remember that about 2/3 of the senior Americans will encounter serious medical illnesses, be it cancer or chronic conditions like hypertension, diabetes, chronic lung disease, chronic organ problems. And this is where the traditional Medicare offers them a wide network, the best professionals that they could access in the most available geographic areas to them. It does cost more in the short run, but in the long run, because the Medicare Advantage programs narrow the networks, result in denials, it's better for senior Americans, in my opinion, to choose traditional Medicare. Also, the article highlights a series of reports and articles that outline strategies used by Medicare Advantage to restrict care and deceive Americans and increase profits, such as some marketing scams, bait and switch, aggressive tactics. Also, the advertisers not disclosing the limited networks and prior authorizations. We have to remember that the Medicare Advantage can change their plans every year. So patients may have to change providers and facilities sometimes quite often. So in summary, at least in my viewpoint and based on our experiences as cancer and liquid tumor experts, we believe that traditional Medicare is an important consideration. Now, for the people who choose traditional Medicare, they have to make sure that they also secure the separate Part D plan to cover medications, and also buying the supplemental policy, which is a Medigap, which will help for the additional out-of-pocket expenses. What is the message for the patients? For senior Americans, the message is, as you are embarking on enrolling into either traditional Medicare or Medicare Advantage, be very careful about the details of those plans. Medicare Advantage is not one insurance, it's a variety of insurances. Some of them are outstanding, many of them may not be, particularly because to make profit and to lower the monthly payments, they will have to restrict networks and experts. For the physicians, particularly experts who are dealing with cancer and chronic conditions, I think it's important in order to protect the patients from harm, it's important to discuss with them the benefits and disadvantages of traditional Medicare and of Medicare Advantage, and to advise them on which insurances might help them most. And again, I would encourage you to read the article. It's entitled Traditional Medicare or Medicare Advantage, ? The Leukemia and Cancer Perspective, and it should be coming out soon in the Mayo Clinic Proceedings. Thank you very much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.